He had a clinic come his house. बच्चे भी आया उस दिन clinic के अंदर. And then एक कोल्हापुर डॉक्टर started getting fearful. मुझे कॉल किया. अब मुझे पूरा फैमिली को रेबीज वैक्सीनेशन देना है या नहीं देना है या only I should take. I said, doctor, who was in contact with the patient in the clinic? He said, only my child and me were there that day. I said, you won't take, the others don't have to take. हो गया एक साल के बाद वापस डॉक्टर का फोन. Sir, I have heard that there are long incubation period in rabies. Rabies can come after 1 year. I said, don't worry, you take one more dose as a booster. Again after 6 months, he is not happy. How do I know I am protected against rabies? Yeah, how do I know my antibody levels? I said, now you go to run vaccine lab, do an ELISA test for rabies antibodies. And when he did the test, the antibodies was 3 times more than normal. His phone call stopped. This is the fear. This is the fear of a doctor. This is the fear of a patient. Any patient of dog bite is fearful. That's why you have to probably give him a little guidance and make him feel better in this whole step of rabies treatment. How I have dog bite with them. The second way is nothing much to talk. Pharyngeal, laryngeal spasm, fear of water, hydrophobia, terror and excitement, restlessness levels, then the paralytical phase, limb convulsions, unconsciousness, and then death. But this phase, sometimes you may see a patient. My experience of 28 years with rabies vaccines, tissue culture rabies vaccines launched in India, is one thing I can tell you is, we have seen prodromal phase patient coming to us and later developing paralytical rabies when they take incomplete dose. 5 injection के बदले अगर 1 injection दिया, then they develop rabies and come to us, they come to a doctor with paralytical rabies, which I will show you later, rather than a clinically well-defined rabies like hydrophobia, aerophobia, बिल्कुल नहीं है. As a doctor, again this is a little confused. I'll come back. Next. So what are the types of rabies? Furious or prime rabies. This 80% patients, high motor activity, shortness of breath, hydrophobia, aerophobia. Aerophobia means fear of air, fan. Photophobia, fear of light, and increased salivation. Next. But what is important to understand is in India, we are seeing 20% of the patients having paralytical or dumb rabies. Now in this क्या होता है problem क्या है? Diagnosis problem आता है. There is no hydrophobia, no aerophobia, no photophobia in this patient. The normal rabies patient 7 दिन के अंदर मर जाता है. This patient survives for 28 days, even sometimes 1 month. The doctor finds it very difficult to understand a difference between paralytical rabies and Guillain-Barré syndrome now. In fact, one Dr. Jain from running a nursing home in Nagpur, 40-bedded hospital. 3 महीने कुछ पहले मुझे ऑफिस में फोन किया. There is a patient admitted to my hospital, and I was treating him for Guillain-Barré syndrome, but the patient is not showing any response. Now I presume he is developing rabies. Then he is asking me, how do I differentiate Guillain-Barré syndrome and paralytical rabies? Very difficult question. There are only 2 things you can differentiate. One, if you take an MRI scan of a Guillain-Barré patient, the MRI scan will be absolutely clear. But if you take an MRI scan of a rabies patient, the complete black lesion picture will be there. It's a black color lesion. Number 2, when you start immunoglobulin treatment for a Guillain-Barré patient, next day the patient slowly starts showing signs of recovery. But when you start the same treatment for a rabies patient, the patient keeps on deteriorating further. There is no response. Number 3, a Guillain-Barré patient has a control on his urinary sphincter muscles. So he doesn't urinate anywhere. But a rabies patient has no control on his urinary sphincter muscles and he will urinate even on the bed or wherever he is. So these are the only 3 small differences you have between Guillain-Barré syndrome and paralytical rabies. And this is increasing in the world. 20% of the patients today come with paralytical rabies, and this is where I told you a statement before. In my experience of 30 years in this brand, I have seen that when the doctor gives 1 injection and the dog bite was a rabid dog bite or rabies dog, the patient may come to your clinic with paralytical or dumb rabies. He may not come with a full-blown hydrophobia, aerophobia, he will come in this situation. And it's a very difficult situation for some doctors to diagnose. Next. Next one, just come on. And the noticeable symptoms, come back. Noticeable symptoms here are a classic paralysis of the limb, which can get misdiagnosed as a case of encephalitis or limb. Very difficult subject for anybody to understand paralytical rabies and Guillain-Barré syndrome. Next. So how do you prevent rabies? Wash the wound plenty with soap and water. Apply an antiseptic. If you ask me which is the best antiseptic, I would say povidone-iodine is the best because it has got bacterial and viral properties. And the status of tetanus should be checked. Tetanus prophylaxis is a must in all dog bite patients. In fact, again in Bangalore we had a case of a patient dying of tetanus rather than of rabies after a dog bite because the doctor did not give him a tetanus injection. So it's important that you give a tetanus dose also to your patient. And what is happening in India is only 50% of the population of India follow this proper first aid treatment even today. Washing the wound is not done by 50% of the Indian population. And if you find your patient has not done it, tell him to go to your wash basin. Give him a soap, let him wash it there itself. Next. Why I'm telling you about the soap and water. If you see the rabies virus structure, this is a cross-section structure of rabies. Unfortunately, I'm sorry, I don't have a point of it. A cross-section structure of rabies virus. If you see, the outer layer is thing called G protein. हम लोग जब varroa trans में बनाते हैं, we only take the G protein, this red color, to make vaccine for you, your patients. Below that, you have an yellow color, which is called the lipid bilayer. Now, when your patient uses soap, soap contains detergent. And this detergent activity of soap destroys this yellow layer of lipid virus. And there is studies that have been instituted in Bombay where they have said that 60 to 70% of the virus can be killed if the patient uses soap and water for 10 minutes only. That's all. So apply soap, keep it under water. Apply soap, keep it under water. You can kill 70% of the virus. In fact, if your patient does this step of soap and water, you are treating a safer patient. And even if he has not done at his residence, please ask him to do it in your own clinic. Give him a lifebuoy soap, let him apply a lifebuoy soap, let him put water like that around 5 minutes is sufficient. But it is a life-saving step. Okay, next. But what happens in a place like Godhra? You will find the patient with a dog bite. Even now when we met a pediatrician, he was saying the same thing. This is things which patient does. Apply chili powder, mustard oil, turmeric, lime, chunna, everything to the wound and rub it, thinking the virus is killed. Do not cauterize or burn a wound. If you do this, you are creating an anaerobic environment and the rabies virus grows faster. Do not cover the wound. In the moist environment, the virus grows faster. In a dry environment, rabies virus is slow growing. Avoid switching. This I can tell you, I was sitting in Nair Medical College around 3-4 years ago with the anti-rabies clinic department. The in charge that day was a lady plastic surgeon, MS doctor. And I saw her in front of me. A patient came with a severe bite. She took the needle and the suturing and she sutured the wound. I said, madam, you should not be doing this because you are not using soap and water. You are not using rabies immunoglobulin. You have just got the patient new. What are you doing here? If you suture, you are pushing the virus closer to the peripheral nerves. You are pushing the virus closer to the peripheral nerves. And the rabies infection occurs faster. So that is important. Don't suture. I am not saying you should not suture. You can suture after washing the wound with soap and water, applying povidone-iodine, applying a rabies immunoglobulin inside the wound, and then you are loose suturing rather than a tight suture. That's important to understand. Next. This is what happens in India. In Hubli, Karnataka, this man gets 300 patients every Sunday taking a herbal drink and applying paste for antibiotics. 1,200 patients a month this gentleman gets. And this is the patients of India who are misguided by. Next. So what is the concept of immunization against rabies? When you give varroa injection to your patient, you are following an active route of immunization. Is my problem here? Is my problem ATID? The antibody will form only after 7 days in your patient. Doesn't matter because the incubation period is 2 weeks to 3 months. Generally. Passive immunization is nothing but RIG, rabies immunoglobulin. What is the advantage of this? You are giving an antibody on day 0 itself of the bite. Ideally, in 3rd-degree bites, you should give this plus this. But let me tell you in India, 98% of the Indian doctors don't use rabies immunoglobulin. Only some hospitals use it. And that's why I always tell the doctors, if you are using only an anti-rabies vaccine to save your patient's life, use a good tissue culture vaccine from a good company. Do not compromise your vaccine because you are not even giving a RIG. In fact, I got a report yesterday from Karnataka. A patient has filed a case against a doctor, patient's relative, that you have not given RIG to my child when he had a bite on the neck. And the judge has given 1,75,000 to be given by the doctor to this patient. So if you are using a good tissue culture vaccine, I know that in India 90% of doctors are not using. But if you are not using, please use a good tissue culture vaccine. And another thing I will tell you very frankly, which I will talk later also. If you are not using an RIG and you find that the bite is severe on the neck, anything about the neck, fingertips, toe tips, or your genitals, 5 areas. 5 areas above the neck, fingertips, toe tips, and your genitals. Please, if you are not using RIG, what I recommend for you, all of you, is give him 2 doses on day 0. One on the right hand and one on the left hand. What are you benefiting your patients? You are stimulating both the lymph nodes, and there are studies to prove that a faster and a higher antibody levels are seen in your patients. This is the best alternative for an absence of rabies immunity. It is not substitute. It is an alternative. Okay? This is and then continue your remaining 4 doses. So total patient will take 6 doses instead of 5 doses. Okay? That's the best alternative for your patients. Next. WHO category of bite. Okay, let's go forward. Nibbling of an uncovered skin, category 2, without bleeding. Only a good tissue culture vaccine, both for a stray dog and for a pet dog. Without, I underline the word without bleeding. Next. Single or multiple transdermal bites or lip or mucous membrane, rabies vaccine and immunoglobulin for a stray dog. Healthy dog, you need not give immunoglobulin because you can wash the dog. Pet dogs, you don't have to give immunoglobulin, so you can wash the dog. Next. Post-exposure prophylaxis, you know the dosing, I don't have to tell you, 0, 3, 7, 14, 28. I only put this calendar here to tell you that suppose you start the first dose on day 0 on a Sunday, all the doses will follow on the Sunday except the second dose. So today is Thursday, suppose you start the first dose on today is Wednesday. So if you start on 3rd, you will find all the doses will be on a Wednesday except the second dose will be 0, 1, 0, 1, 2, 3 on a Saturday. So this is just to tell you whether you can understand the patient is coming at right time to your clinic or delay to your clinic or before time to your clinic. Next. One more mistake we all make in India is, I don't know how many of you are doing that mistake even today. You give the vaccines in the glottal area. Please do not give a rabies vaccine in the glottal area because you will lose vaccine potency because of the fat tissue present there. So if anybody of you are still giving a rabies vaccine in the glottal area, please stop it and give it only in the deltoid area of the patients. And in small children, you can give it in the anterolateral area of the thigh, but not in the glottal area. Next. Immunoglobulins, I am not going much deeper into that. There are 2 types. HRID is human rabies immunoglobulin. The dose is 20 IU per kilogram body weight, maximum 1500 IU. Number 2, equine rabies immunoglobulin, ERIG. The dose is 40 IU per kilogram body weight, maximum 50,000 IU. But the problem with equine rabies immunoglobulin is you can give it only after a test dose is done. Human rabies immunoglobulin, you can give it without a test dose. This is costly, this is 5,000 rupees per injection, and this is 500 rupees per injection. Both are not very freely available in India. So the best alternative, if you are not giving this, please give 2 doses on day 0, especially in 3rd-degree bites per patient. Next. This is how the immunoglobulins protect. The first 14 days, they protect the patient, and then Verorab takes over and protect the patient lifelong, basically. Next. A very important slide. I don't know how many of you are aware of this new change in the WHO policy now. We had done a study with Verorab for 20 years in Bangkok with WHO Collaboration Center. And this was the report derived out of that. If your patient has taken 5 injections of Verorab on day 0, 3, 7, 14, 28, or 3 injection pre-exposure, 0, 7, 21. Pre-exposure or post-exposure, after a bite, before a bite. Then, if he is bitten by a dog, again this is lifetime. Then you have to only take 2 doses on day 0 and day 3. And the biggest advantage for the patient is no requirement of a rabies immunoglobulin. You don't have to give rabies immunoglobulin or RIG. Even if the face or a head is bitten by a dog, no RIG to be given to this patient. And this is independent of the interval to the last injection. That means 3 महीने के बाद आप 5 इंजेक्शन आ दिया पेशेंट, 3 महीने के बाद वापस आपके पास आ गया 2 इंजेक्शन, 3 साल के बाद आ गया 2 इंजेक्शन, 30 साल के बाद आ गया 2 इंजेक्शन. प्रोवाइडेड पहले उन्होंने पूरा 5 इंजेक्शन दिया पोस्ट एक्सपोजर या 3 इंजेक्शन प्री एक्सपोजर. This is a new thing which has come in the WHO bulletin for 2010, and one of the major study, the lead of the study was given by us, Verorab, in Bangkok in the WHO Collaboration Center. And now they have changed this, that only 2 doses is required. इसमें एक ही condition है कि patient should be a healthy patient, not an immunocompromised patient. अगर आपको लगा कि patient immunocompromised है, don't give 2 doses. You give him full 5 doses and release him. But if the patient is healthy, he is not on a steroid, he is not taking any, he doesn't have any major chronic bimari. In that case, 2 doses is sufficient. And why I am telling you this? We have seen many times a pediatrician telling us that बच्चा 3 महीने के बाद वापस कुत्ता काट के आ गया, मुझे 5 इंजेक्शन देना है, जरूर नहीं, आप मुझसे 2 दे. कई पेट ओनर्स जिसके पास घर में कुत्ता है, हर साल आते रहेंगे डॉक्टर के पास, डॉक्टर कुत्ता नहीं काटते. तो ऐसा नहीं कि हर साल आपको 5 इंजेक्शन देने, वहाँ आपको सिर्फ थोड़ी देनी. हाँ, patient is having some problem or chronic problem, and you give him full 5 injection and RIG also. Next. This is a study which we did in that time 20 years ago. 20 साल के बाद we checked the antibodies, and then we give a booster on day 0 and day 3, and this is the result of the study. By day 7, all the patients were protected above 0.5 minimum protection. All the patients were protected against rabies, and by day 14, the antibody level was 10 times more than normal. Next. This is the result of our doctor study. एक डॉक्टर को महाबलेश्वर जब गया था छुट्टी में हॉलिडेज में, कुत्ता ने काटा तो उन्होंने 1 इंजेक्शन दिया था महाबलेश्वर में, और यहाँ वापस आके मुझे फोन किया क्या करना है, बोला 2 ले लो. पर उसके पहले मैंने उनको बोला, क्या बोला कि आप 1 इंजेक्शन लिया, आप एक एंटीबॉडी स्टडी कर लो. And he did an antibody study on day 7, or immediately when he came to Bombay, we took the blood sample, he gave it to Ranbaxy Religare for a rabies antibody study. And the rabies antibody studies is this result. 1.5 times, which is almost 3 times more than normal. Minimum protection is 0.5 IU. And the studies showed 1 injection देने के बाद 1.5 IU, 3 times more. This doctor had taken 5 injections around 2.5 years ago. And after 2.5, when the second bite took place in Mahabaleshwar, he took 1 injection, and we did this study in Ranbaxy lab. Next slide. This is the same thing, WHO guidelines. That no RIG should be aware. This is from the WHO book page I am showing you. That WHO has approved is 1 dose on day 0, day 3, that's all. And no rabies immunoglobulin should be used. Next. This is one of the best results, best examples I can show you on good tissue culture vaccine. In the United States, recently the last rabies transplantation, a patient who died of rabies, the organs were transplanted to 5 people. Arterial graft, a liver transplantation, a kidney transplantation, and a corneal transplantation. After transplanting organs from a rabies infected patient to a normal 5 patients, 4 of them died of rabies. But one survived. One lady survived. They checked the CSF level. They found that the rabies anti-protective antibodies was very high, almost 280 times. They checked the serum. They found the rabies antibodies was high. When she came back to consciousness, they asked her one question. Have you taken a rabies vaccination in your past? You know what she said? उन्होंने बोला कि मैं अपने पिताजी के साथ जब इंडिया में गया था, when I was a child of 14 years, 14 साल के बच्चे थे तब उस टाइम में पिताजी के साथ इंडिया घूमने गया था. I was bitten by a stray dog, and the doctor in India had given me 5 injections of a rabies tissue culture vaccine. And that lady survived even without 2 doses. इस लेडी को 2 डोज की जरूरत नहीं पड़ा. बॉडी का T cell memory जो कहते हैं ना, T cell immune memory, that T cell memory itself started producing antibodies, and the patient survived even without taking any single injection. So this is the power of a T cell memory response with these brands. So it is enough that, and I recently yesterday also in Bombay, one doctor that day, his patient, I just completed a ELISA study with a rat vaccine lab. The patient with 2 doses is completely protected. Now, unfortunately, ELISA study is only possible in your areas because you can send a blood sample also to Siemens Bangalore for a rabies antibody test. It is only 500 rupees. ELISA will be costing 1200 rupees ELISA test. But this is only for your information. You can do it. Next. Pre-exposure 0, 7, 21 or 20. Optional is not for you. It is for veterinary doctors and all these people. Don't worry about this. But if a child, ऐसा कभी कई बार होता है. दिल्ली में जब मैं प्रोग्राम किया था, डॉक्टर्स बोल रहे थे कि घर में कुत्ता है, बच्चे आते रहते हैं. My child has been beaten. What you can do best is to give him a pre-exposure. 0, 7, 21. 3 injections देना है. That's all for your patient, and you will give this child a lifelong protection against rabies. Our pediatricians give 2,000 rupees of chickenpox vaccine. Not a life and death situation. You are giving hepatitis A vaccine. Go ahead. But why not give a rabies vaccine? Because it is a deadly, 100% fatal disease. Patient, बच्चा मर जाएगा. Give him a pre-exposure, 0, 7, 21. That's all. Let him go and play outside. Don't fear. Parents don't have a fear. Anytime he is bitten, just give him 2 doses, 0, 3, that's all. You are giving so much of protection for this child against a 100% deadly disease. Next. This is the situation in India. 50% of the deaths in India are small children less than 15 years. And loss of this innocent life is 100% preventable with a pre-exposure vaccination. Next. And what is the advantage? What are the problems in children? A shorter body length, therefore the bite is on the head and the face. बच्चों को जब कुत्ता काटता है तो यहाँ काटता है. आपको जब कुत्ता काटता है पैर पर काटता है. Ignorance, curiosity for pets. A child doesn't know. He goes and puts the hand in the mouth of a dog, and he will not even tell his parents. Fear of reporting to parents, including my sister-in-law. She's a doctor. Her own daughter was bitten by a dog in the school. She came and told my sister-in-law that I was riding the cycle and they fell down. So fear of reporting to parents. Incomplete vaccination of a child. 5 doses नहीं दिया, 1 ही दिया, 2 दिया, RIG नहीं दिया बच्चे ने, because it's very painful for a child. All this you can avoid if you can go for a pre-exposure intradermal. I know I'm telling a statement which is intradermal. Intradermal means वेरोनम इंजेक्शन से 0.1 ml इंजेक्शन आप दीजिए. आपके पास 4 बच्चे रहेगा, उस दिन चारों बच्चों को 0.1 ml दीजिए. अब 200 रुपये में आपका प्री एक्सपोजर कोर्स खत्म हो जाएगा. इंट्रामस्कुलर आपको 1000 रुपये खर्चा करना पड़ेगा. इंट्राडर्मल रहेगा तो आपको 0.1 ml देके बच्चे के स्किन के नीचे देना है. इट इज नॉट अ लाइफ एंड डेथ सिचुएशन. यू कैन डू इट. पेशेंट मरेगा नहीं. But you are protecting this child for a long-term purpose. Lifelong protection दे रहे हो. So this you can do intradermal point with veroram. 0.5 ml का veroram आपको 4 डोज मिलेगा. 4 बच्चे या फैमिली पेट डॉग रहेगा तो हस्बैंड वाइफ और 2 बच्चे, उनको आप 0.1 ml एक दिन बुला के दे दो. Under the skin intradermal, you are saving the life of these patients, of these children for a long-term purpose. And in case of a repeat bite, you are only give 2 doses to this child on day 0 and day 3, and no repeating dose of day to be given to this child. Next. So what are the factors influencing treatment? Doctors have to check first the potency of the vaccine. Remember one thing, when I give you Veronac from Sanofi through Zoetis, I am giving you a vaccine with 3 times more potency than what WHO has said. WHO कहता है कि वैक्सीन पोटेंसी होना चाहिए 2.5 IU per dose, और आप हमारे कोई भी बैच निकालिए बिफोर एक्सपायरी, आफ्टर एक्सपायरी you will get 7 IU per dose, almost 3 times more potency, and that potency helps the patient to have a better antibody response. Immunogenicity and potency is linked. Transportation cold chain. दिल्ली में सफदरजंग हॉस्पिटल में patient मर गया of rabies after using Indirab, and now police and the doctors are saying that the vaccine was kept outside, there was no cold chain maintained. So this is not with Sanofi. Sanofi is the world's largest vaccine manufacturing company, and we have the best technology to move goods under cold chain conditions. Next. Post immunity. Evaluate your patient's under responsiveness of the immune system of your patient. Maybe due to an underlying disease, maybe alcoholism, maybe cirrhosis, maybe he's on steroid, anti-malarial, or any other immunocompromised condition. यहाँ आप 5 इंजेक्शन देगा बोला patient मर गया because he's immunocompromised patient. The patient does not develop antibodies. So you have to evaluate the patient's immune response of his responses of the immune system. Patient has had soap and water, odonidin, tetanus, high risk exposure, as I told you. 5 areas are high risk exposures: fingertips, toe tips, head, neck, and face, and the genitals. These are the 5 high risk exposure for your patients. Next. So check whether the doctor has given, whether you want the RIG in severe exposure or no. Check whether the RIG is given round the moon by a previous doctor. Many a times, आपको मैं क्या बताऊँ? चंडीगढ़ में मैं 2 महीना पहले चंडीगढ़ और 100 doctors I was talking. Anti-rabies clinic center doctor was there in the meeting of mine. Meeting के बाद I asked her, मैडम आपके पास कितना पेशेंट आता है? बोला मेरा क्लिनिक में तो रोज 35 to 40 patients come of dog bites. So I asked her, how do you manage to give rabies immunotherapy? And can you tell me उनका जवाब क्या था? बोला मैं कभी I don't give it inside the wound. गाँव में दे देता है, मैं इंट्रामस्कुलर दे के भेज देता है. But doctor from a ARC center. So many of the doctors do the mistake of giving an RIG in the intramuscular. RIG should be given inside the wound, where the bite has taken place. वहाँ RIG देना है. और many of the doctors give RIG intramuscular. Delay vaccination. Any dog bite patients, आपके पास आप 48 hours के बाद आएगा तो he is late for treatment. He is not at right time for treatment. Routine area. Previous doctor has given a routine area. What you will do? You may have to restart the dose sometimes. अगर उन्होंने एक इंजेक्शन गुजरने नहीं और आपके पास आ गया, तो you may have to restart the dose, because in Malaysia there was a patient who took RIG and rutilarea 5 injection, died of rabies. So you have to be very careful. Don't give it in the rutilarea. Fat tissue will prevent the absorption. Next. Now these are the reasons where you can double the first dose. If RI, जैसा आपने आपको बताया, एक इंजेक्शन देने के बदले 2 इंजेक्शन कब देता है? If RI is not available in class 3 bites, if a patient has underlying chronic disease, if the patient is immunodeficient or has got AIDS, if the patient is on steroids or antimalarials, if the patient does not use soap and water or uses chili powder and turmeric to rub the wound, such cases, or the patient comes to your clinic after 48 hours, 2 दिन के बाद, such situations it is safer to give 2 injections on day 0, 1 on the right hand, 1 on the left hand, and then continue your remaining 5 injections. Pregnancy is not a contraindication. Veronac pregnancy study, we have 271 pregnant ladies given Veronac worldwide, and we have also given Veronac in the first trimester of pregnancy. So Veronac is not contraindicated in pregnancy. No reports of vaccine related